Greetings to you all, brethren. I'm sharing with you shortly on preterm delivery or preterm babies. So you will look at what is preterm delivery, or when can we say a baby has been born preterm, and some of the causes we will look at, and the preventive measures. Preterm delivery, or when can we classify a baby as a preterm? Preterm delivery is when one gives birth or put to birth before 37 weeks of gestation. That's when the fetus comes out before 37 weeks of gestation. This is when we call that individual has given birth preterm, giving birth to a preterm baby. And according to WHO, this preterm delivery is on the increase, and currently they can count about 15 million births that are classified as preterm yearly. And this preterm and its consequence is actually one of the leading cause of death for our under 5 children. This according to WHO. So let's go straight to some of the factors that brings about preterm delivery, or that will cause one to give birth to a preterm baby. These things we can start by talking about issues with the placenta, issues with the cervix, issues with the uterus. This is the room or where the fetus is. So when it happens that the fetus is having issues with the placenta, that fetus automatically will be distressed. And at times doctors have to go in to save that fetus. So one can have issues with the cervix, and this is when the cervix is incompetent. Talking about incompetent cervix is when the cervix is unable to remain intact till term. So eventually the content of the uterus have to come out. Yes, but we have some other common causes. Which we'll be looking at. But aside that, we have other chronic conditions that when the mother is suffering, that individual is also prone to be delivering preterm babies. And this is when the mother is suffering from hypertension, that's high blood pressure. Again, when the mother is suffering from diseases like diabetes, yes, babies. And again, we have some of the common things that when we do, or when our females they do, it exposes them to giving birth to preterm babies. And some causes to preterm delivery. We have nutritional deficiencies, that's before and during pregnancy. Don't forget that the nutrition of the mother is what the child is feeding on. So when it happens that there are deficiency in the nutrition, that is during pregnancy, automatically it will be exposing the fetus to move out. Yes. And we have taking in drugs, illegal drugs, or drugs that are not prescribed by doctors. Yes, at times goes a long way to expose that individual to giving birth to preterm babies. Smoking cigarette, weed, or anything that we smoke goes a long way also to push our fetus out or cause preterm delivery. And also taking in alcohol also exposes the individual to giving birth prematurely. Also, we can talk about multiple pregnancies. And multiple pregnancies conceive several times. Others were able to take it to term, others abortion came in and all those things. But if that individual have had multiple pregnancies, the possibility of exposing that individual to giving birth to preterm babies is very high. This said, let's ask, what are some of the things that we can do to prevent it? Because we need to understand that some of the things are uncontrollable. We can't control it. We don't have the upper hand on it. But there are some of the things that we can do to ensure that the fetus is in good condition and the mother also in good condition. And when we're able to balance all these things, the fetus will be able to stay to term. So what are some of the preventive measures? Some of the preventive measures is for us or for our females to ensure that their nutrition is adequate. They are meeting the standard, the required nutrition, the required for their fruit and vegetables, their carbohydrate, their protein, it's like everything that is expected in nutrition, they will be up and doing in that field. And any drug that they want to take, they have to ensure that it has the backup and the recommendation of the health practitioner. And again, it will be best you start your antenatal as early as possible so that your midwife will take you through the necessary precautionary measures and will get time to teach you the best things so that you will not expose yourself to anything that will endanger the life of the fetus and you yourself, for that matter, bringing about preterm delivery. So today we are just bringing this to your notice that preterm is not a curse. Yes, get this in mind. When someone gives birth to a preterm, don't laugh at that person or don't think that person is someone that abused drug, that person is a drug addict or that sort of thing. Because there are some other factors which we said may be issues with the cervix, maybe issues with the placenta, maybe issues with the uterus, that individual does not have upper hand in controlling it or does not actually be a direct cause to that experience that individual is going through. Don't forget that genetic factors can also expose one to having preterm deliveries. Yes, so the other things that we can do is to focus on our nutrition, focus on taking the right medication and reporting to the facility as soon as possible. We talk to our midwife for them to guide us, and I believe that will help our females to come out with healthy babies that will be born full term, and we won't have any issue with this preterm. Yes, we have devoted ourselves, or we are looking forward that we will support our preterms, support our preterm babies. But we pray that you will not have a preterm baby. Yes, we pray that you will not have a preterm, but when you have a preterm baby, we assure you that by the help of all health workers, they have vowed to see to it that your baby will live. So you too, join the fight for us to come